The Delta variant of the coronavirus continues its global spread. Israel's been forced to reimpose mask mandates indoors just 10 days after lifting the measure. The country's coronavirus response chief said that they're seeing a doubling in case counts every few days. And just crossing the wires, Hong Kong will ban all travelers from Britain, adding that the country back on its extremely high-risk list. Joining us now on the Squawk Newsline is Dr. Scott Gottlieb, former FDA commissioner and CNBC contributor. He also serves on the boards of Pfizer and Illumina, and there's also predictions that it won't be long before the Delta variant is the predominant one in the United States. But, Doctor, predominant in the United States, given our vaccine levels, would be, tell me if I'm wrong, would still be a low total level of COVID infection in this country, even if it were to become the dominant variant. It's not just going to take over the entire population again.
I think that's right. We're talking about the growth in cases in the UK and in Israel, and we're talking about the growth in cases off a low baseline. I don't think we're going to have a situation like we did last winter where there's 200,000 cases a day. I think that we're talking about tens of thousands of cases perhaps a day here in the United States as this starts to take hold across the country. And it's going to be highly regionalized. There's parts of the country that are going to be largely impervious to a lot of spread, and other parts of the country that are more vulnerable. Even in Israel, I think Israel is a poor proxy in terms of what they're doing relative to our situation here, because Israel's really going for a situation where they want zero COVID. We're never going to have zero COVID in the United States. We're always going to have some level of spread. This is going to become an endemic. We're not going to try to get this down to 0 cases a day. Israel is trying to get it down to 0 cases a day, so that's why you see them taking different kinds of measures than us. Hong Kong's trying to keep it out completely. That's why they're banning travel. But we're likely to have persistent infection here in the United States. And again, that doesn't mean that we need to have 200,000 cases a day. I think we don't get out of a situation where there are, 20, 25,000 cases a day in the United States. But we need to understand that represents far less impact than it did a year ago, because more of the vulnerable people who are going to be more susceptible to this infection now are protected through vaccination. And final point, if you look at what's happening in the UK right now, it's a pretty good proxy for that experience. There's about 90,000 Delta cases that they've recorded, but they've only recorded 117 deaths. Now, that's tragic, but it's far down from what we saw from previous levels. The case fatality rate there right now is probably somewhere between 0.2 and maybe 0.3%. And even if you look at hospitalizations, they've only had about 1,000 hospitalizations of those 90,000 cases. And of those hospitalizations they've had, only 8% of the people who've been hospitalized are people who are fully vaccinated.
Right. So to sift through the headlines once again, and we don't have double-blind studies to say this is definitively true, but it looks like even vaccinated people, some of them can get the Delta variant, but it doesn't look like you get very sick. Looks like the vaccine protects you against getting really sick. But does that mean if you've got it at that point and you're vaccinated and you come in contact with people who aren't vaccinated, they could get the Delta variant and then they could get very, very sick? So I'm going to sound like a vaccinista again here.
Thank you. That was my question, too.
Right. Well, does it, as a isn't that just like you should be just pounding, get vaccinated, because the Delta variant won't hurt necessarily the people that have the vaccines, but you could, if you don't have the vaccine, you're not protected.
Yeah, look, we know for a fact that the vaccines substantially reduce your likelihood of spreading the infection. So if you're vaccinated, even if you get mildly symptomatic or asymptomatic infection, you're far less likely to spread the infection to others. And that actually was the basis for the CDC lifting its indoor mask requirements and its outdoor mask requirements, for that matter, for vaccinated people, because they looked at the data and they said even if you get infected, if you're vaccinated, you're far less likely to spread the infection. Therefore, you don't need to wear a mask. Now, whether or not the Delta variant makes it more likely that you could spread the infection even if you're vaccinated, we don't know, because we don't really know why the Delta variant is more contagious. But one of the theories in terms of why it's more contagious is that you might shed more virus. You might have a more sustained period where you're shedding a lot of virus particles, and that's what makes you more contagious with the Delta variant. And if that's true, it might be the case that you're slightly more contagious even if you're vaccinated, but you're still going to be substantially less contagious than if you were unvaccinated. So another reason to get vaccinated, besides protecting yourself from long COVID, is that if you're around children, if you're around vulnerable people, you're far less likely to be a chain in a link of transmission if you're fully vaccinated. You're far less likely to introduce the virus into a workplace setting. You're far less likely to bring the virus back into your home. So that's another very strong reason to get vaccinated.
Shepard Smith here. Thanks for watching CNBC on YouTube.